Hi, I'm Sharon. Today we're going to be demonstrating a hand examination. This consists of PA, oblique, and lateral projections. Before you go get a patient, you will need to set up your supplies and your room. That includes having a 10 by 12 cassette, radiolucent sponges available, markers left and right, depending on which side you're going to be doing, lead apron, and tube. To set the tube, you need to go to 43 inches on our measurement for our tube. That would be 40 inches to the tabletop. And since we're going to have the patient sitting at the end of the table with his knees away from the tube, we're going to have to move the tube down to the end of the table. We're using a 10 by 12 cassette, so you're going to go to 40 inches SID on your collimator and collimate to 10 by 12. This would be your cassette size. This is Ramon. When you get a patient, you need to verify name and date of birth. So the dialogue could go something like this. Hi Ramon, can you tell me your last name and date of birth, please?
Last name's Perez, date of birth is 4/11/84.
And then you would check that with your requisition, making sure that you had the correct patient. If this had been a female patient, you need to make sure to ask if there's any possibility of pregnancy. We already have shielded our patient before we started filming. So that's your right hand. Again, you verify that with your requisition, ensuring that it is the proper part. We want to do a PA, oblique, and lateral projection. We're going to start with the PA projection, which is going from the back of your hand to the palm of your hand, exiting. So the palm of the hand is going to be on the cassette. You want the central ray to go through the distal end of the third metacarpal, which is your third knuckle. And that's going to be to the center of the film. You want to have a little bit of light in between each of the fingers. Can you please bring your fingers together for me a little bit? Not so much, just a little bit. There you go, good. You want to place your marker to the lateral side out of anatomy. For the PA projection, you also want to get from the tips of the fingers through the carpal bones. So you're including the entire hand, the hand in its entirety. From the PA projection, you go to an oblique projection. You do not position the patient by the injured part. Do not grab their hand. For an oblique projection of the hand, again, you move from below the injury. You want a 45-degree angle. So you're going to show slight superimposition of the third, fourth, and fifth metacarpals and space in between the second and third metacarpal. You can also use a radiolucent sponge if need be to get a 45-degree. Okay, you want your central ray, again, to be about the third metacarpal, distal end of the third metacarpal. So that's going to be right there. Making sure that you do not clip anatomy, which most times is going to be the sponge on or the thumb on the sponge here. You don't want to clip the thumb. Projection, it's a lateral, which is all the way up and down, 90 degrees from the PA. Sir, can you karate chop the board for me, please? Hand in the center of the film. Very good. Bring your thumb down next to your hand. You want to make sure Ramon's got a nice straight hand, which is good. You want to not have a cupping effect, which is when they cup their hand. You want it nice and straight. Good. So you can see our central ray is not over the metacarpals. So we're going to need to adjust that. Okay, so you want the central ray over the metacarpals. You want to get from the tips of the fingers through the carpal bones. And on a lateral projection, it's skinnier than a hand, so you can come in quite a bit without clipping the thumb. So if Ramon had his thumb out here, that would be clipping, and you would have to repeat. Go ahead and bring your thumb in for me, please. Make sure your marker is in the light on the lateral side. And this is a lateral projection. So again, you would have a PA, oblique, and lateral projections for a hand examination.